Working to gather more information on a breaking news situation. The eldest son of NBA superstar LeBron James has suffered cardiac arrest and collapsed while practicing with his team at the University of Southern California ahead of his freshman season there. He is just 18 years old. This is Bronny James. We have few details at this time, but the James family has confirmed the news, saying that Bronny was taken to the hospital and is now in stable condition, but was in the ICU. They say they will give an update when they have more information on his condition and have asked for privacy. Damar Hamlin, the Buffalo Bills safety who also suffered cardiac arrest so publicly earlier this year, reacting to the news, saying prayers to Bronny and the James family as well. Here for you guys, just like you have been here for me through the entire process. Joining us now to talk more about how scary a situation this is, Dr. Chris Pernell, Regent at Large for the American College of Preventive Medicine. You saw Damar Hamlin collapse on the field. We all did in January, revived thanks to the medical staff. It sounds like a similar situation with another young, healthy athlete in Bronny James. What is cardiac arrest and how rare is it to happen in active young people like we're seeing?
Morning, Marni. So what we're hearing and experiencing when a person has a sudden cardiac arrest is that their heart stops. Their heart stops, meaning there isn't electrical activity. And the rate of that occurring is anywhere between 0.75 out of one every 100,000 competitive athletes. So it is rare that it occurs, but when it occurs, it can be potentially deadly. Anywhere from 1 out of 50,000 to 1 out of 80,000 athletes will actually have sudden cardiac death from sudden cardiac arrest. So it's very encouraging to hear that Bronny is currently stable. Definitely our thoughts and our prayers are with him. And the main important thing for the public to know is the necessity for life-saving skills and tools in every competitive arena and every public arena. I'm talking about people who are trained to deliver CPR and defibrillators.
Right. And I always say, think about where you are right now. Where is the closest defibrillator? There are apps to help you if you're in a workplace. I know there's one right outside of our studio here. And know CPR and also be willing to use it. It sounds like in this case, medical staff was close by. How important is quick medical attention when the heart stops? And that can help have no long-term consequences as a result.
It's a matter of life and death, and that matter of life and death can be seconds to minutes. We know that in Damar Hamlin's case, there was speedy and prompt medical intervention to restart his heart right then and there on the field, and then he experienced another cardiac arrest en route to the hospital, which required him to be resuscitated again. We don't have full details of what has happened in Bronny James' situation, but I can tell you in the public where you have lay people, meaning people who have not been trained, particularly in life-saving skills, those minutes, those seconds even are crucial and critical. That's why there is a push. There is a push in high school sports arenas. There is a push in public gathering spaces to have those defibrillators and for people to learn CPR and be willing to do it.
Right. The worst mistake you can make, I once had someone tell me, is not do anything at all when somebody goes into cardiac arrest. So take action. So doctors now are going to be trying to determine what caused his heart to stop. What are some of the things that they'll be looking at to find that answer?
Definitely. We're going to do the battery of tests that always happen when a person comes in with any type of cardiovascular signs or symptoms. So he will have an EKG to look at the rhythm of his heart, to see that the heart is producing appropriate and normal electrical rhythms. There will also be an echocardiogram, which is a type of ultrasound that will look at the structure of the heart, and in particular will look at the musculature of the heart. Actually, the #1 cause of sudden cardiac arrest, especially in young athletes, is a hypertrophic cardiomyopathy, where the walls of the heart are thickened and they're stiff and they don't pump blood appropriately, in particular affecting that left ventricle. So they will do an echocardiogram and perhaps a cardiac MRI to look at the walls of his heart to ensure that there isn't some thickening. And lastly, there will just be a full battery of exams to make sure he is in appropriate health, which likely he has gone through, but questioning around the family history. Is there anyone else in the family who has had symptoms, particularly in their youth? And has he had any episodes of dizziness or fainting, things like that?
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.